Hello and welcome. Today we're diving into a complex neurological disorder, autoimmune myoclonus. This condition arises when the body's own immune system mistakenly attacks the nervous system, leading to a variety of debilitating symptoms. Join us as we explore the causes, mechanisms, diagnosis, and potential treatments for this challenging disease. Autoimmune myoclonus is primarily caused by a malfunction within the immune system. Instead of targeting external threats like viruses and bacteria, the body produces antibodies that attack healthy nerve cells. The exact triggers for this immune system dysregulation are often unclear, but genetic predispositions, environmental factors, and prior infections are thought to play a role. In some cases, autoimmune myoclonus can be associated with underlying autoimmune disorders, such as lupus or Hashimoto's thyroiditis, or even certain cancers, known as paraneoplastic syndromes. The pathophysiology of autoimmune myoclonus is centered around the damage inflicted upon the nervous system by autoantibodies. These antibodies can target specific proteins on nerve cell surfaces, disrupting their normal function. This disruption often affects neurons involved in motor control, particularly those in the brain, brainstem, and spinal cord. The result is an imbalance in excitatory and inhibitory signals, leading to the hallmark symptom of myoclonus: sudden, involuntary muscle jerks or twitches. The specific brain regions affected can vary, influencing the type and severity of myoclonus experienced. Epidemiological data on autoimmune myoclonus is limited, as it is a relatively rare disorder. Due to its often varied presentation and the need for specialized testing, it can be underdiagnosed or misdiagnosed as other movement disorders. It can affect people of all ages, though some subtypes might be more common in certain age groups. Research is ongoing to better understand the true prevalence and incidence of this condition in the general population. The primary symptom of autoimmune myoclonus is, as the name suggests, myoclonus. These are sudden, brief, involuntary muscle jerks that can affect various parts of the body. The severity and frequency of these jerks can vary greatly from person to person. Other common symptoms may include ataxia, or impaired coordination and balance, cognitive impairment, ranging from mild memory difficulties to more significant cognitive decline, seizures, and other neurological deficits, depending on the specific areas of the nervous system that are affected. Some individuals may also experience symptoms associated with the underlying autoimmune disorder. Diagnosing autoimmune myoclonus can be challenging, often requiring a combination of clinical evaluation, neurological examination, and specialized laboratory testing. A thorough medical history and assessment of the patient's symptoms are crucial. Blood tests are performed to detect the presence of specific autoantibodies known to target the nervous system. Electrophysiological studies, such as electroencephalography, EEG, and electromyography (EMG), can help characterize the myoclonus and identify its origin. Magnetic resonance imaging (MR) of the brain and spinal cord may be used to rule out other potential causes and assess for any structural abnormalities. In some cases, a lumbar puncture may be performed to analyze the cerebrospinal fluid for signs of inflammation or autoantibodies. Autoimmune myoclonus can present in different forms, and while a rigid classification is not universally agreed upon, distinctions can be made based on the specific autoantibodies involved or the underlying cause. For example, some cases are associated with specific antibodies targeting proteins like glycine receptors or amphiphysin. Others can be classified as paraneoplastic myoclonus, where the myoclonus is a consequence of the body's immune response to a tumor. Understanding the specific type of autoimmune myoclonus is important for guiding treatment strategies. The treatment of autoimmune myoclonus focuses on suppressing the immune system and managing the symptoms. Immunosuppressant medications, such as corticosteroids, intravenous immunoglobulin (IVI), and plasma exchange, are often used to reduce the production of autoantibodies and dampen the immune response. Symptomatic treatment for myoclonus may include medications like clonazepam valproic acid, or paracetam to help reduce the frequency and severity of the muscle jerks. Physical therapy, occupational therapy, and speech therapy may also be beneficial to improve motor function, coordination, and communication skills. Treatment for any underlying autoimmune disorder or cancer is also essential. Currently, there are no definitive ways to prevent autoimmune myoclonus. Because the triggers for the immune system dysregulation are often unknown, preventive measures are limited. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may help support overall immune function. Prompt treatment of infections and management of underlying autoimmune disorders may also potentially reduce the risk, although further research is needed in this area. The prognosis for autoimmune myoclonus can vary significantly depending on the severity of the condition, the specific autoantibodies involved, the underlying cause, and the individual's response to treatment. Early diagnosis and aggressive treatment are crucial for improving outcomes. Some individuals may experience significant improvement with immunosuppressive therapy, while others may have more persistent symptoms. Ongoing research is focused on identifying new autoantibodies, developing more targeted therapies, and understanding the long-term effects of autoimmune myoclonus. Recent advances include the exploration of novel immunotherapies and a deeper understanding of the specific mechanisms of neuronal damage involved in this disease.